generally. As we've said before, expanding testing capacity in the Commonwealth is a major part of our multi-pronged approach to pushing back against the spread of the virus. Testing, I think, as most people know, is important because it helps us determine not only who's infected, but where in particular around the Commonwealth we may have hotspots that we need to focus on. And by figuring out who's infected, we can obviously make sure those people isolate themselves so that they don't spread the virus to anyone else, and that we can then communicate with the people they've been in close contact with in recent days so that they can isolate themselves as well. It also helps our public health workers to do that contact tracing, which is when we figure out all the close contacts of the infected person, get in touch with the contacts, and provide them with the advice they need and ask them to isolate. On Friday, we announced a new initiative between our administration and the nonprofit Partners in Health that will eventually deploy almost 1,000 people who will serve as virtual contact tracers and will do the important work of reaching out to all the close contacts of people who are deemed to have been tested positive. The effort will build on work that's already been done by the Department of Public Health and many of our local boards of health, which has been going on every day. The big issue on this one is dramatically expanding capacity. When you start talking about 1,000 people and you start plowing into that, many of the assumptions that our team has made at the command center with respect to surge and possible cases, we simply need a much bigger platform to be able to deal with contact tracing on a go-forward basis. Another strategy that obviously we've talked about a lot over the last couple days is expanding our medical capacity to treat those who are infected. To that end, we've been working to increase hospital bed capacity, secure key medical supplies like ventilators from the federal government, and increase the supply of personal protective equipment to support our frontline workers as they battle against the virus. And while I'm standing here today in the shadow of Gillette Stadium, I'd be remiss if I didn't take this opportunity to once again say thank you to the Kraft family and the Patriots organization and all of those who worked with us to get the shipment of 1 million masks in from China earlier this week. Now, with respect to testing results, most recently, as of yesterday, we've tested 68,800 individuals. There were over 5,800 tests that were done yesterday. Significant progress on expanding our Commonwealth's testing capacity across Massachusetts. We've said previously that we wanted to test at least 3,500 people a day, and we've been conceding that goal consistently now for almost 2 weeks. We're going to continue to pursue new ways to increase our capacity, and that will include sites like this one here in Foxborough. This site will perform, just opened up this morning, it will perform up to 200 tests per day, perhaps more depending upon available materials and kits for police officers, firefighters, and other personnel who perform critical public safety functions and are experiencing one or more designated symptoms. Testing is performed by appointment only, and eligible workers looking to get tested should contact their supervisors for more information. Detailed information was sent out by the Executive Office of Public Safety and Security on Friday on how to secure an appointment to these public safety departments so that they would know how to follow through on behalf